This is Eunice. She enjoys walking her dogs every day and playing bridge with her gals at the senior center once a week. But one day, Eunice suffered a hemorrhagic stroke. She was released from the hospital recently, but she now has loss of motor control and weakness on her left side, particularly in her leg.
I miss playing bridge with my gals, and now I can't walk my dogs like I used to.
She is now going to see Jane, the PT. Jane graduated from PT school about 8 months ago and does not have a lot of practice treating hemorrhagic stroke patients. Eunice has exhibited that she probably will not have good compliance with her program, so Jane is searching for something new and exciting to keep Eunice interested and involved in her care. Jane has recently heard about robot-assisted gait training and the possible success with treating gait deficits, but she is not sure about the efficacy and applicability to Eunice. Jane has now referred to her research PT friends to help her understand this better in order to treat Eunice.
In elderly stroke patients with hemiplegia, is robotic-assisted gait training more effective than traditional gait training in regaining independent walking ability?
That's very interesting you brought this up, Jane. We were just reading a study on robotic-assisted gait training. This study compared the efficacy of robotic-assisted gait training plus conventional physical therapy to physical therapy alone in improving functional outcomes of stroke patients with hemiplegia. 67 patients were recruited and randomized into two groups, the intervention group and the control group. Both groups received 150 minutes of conventional physical therapy per week for 6 weeks, with the control group receiving additional conventional physical therapy for 90 minutes per week. On the other hand, the intervention group received robotic gait training for 90 minutes per week for 6 weeks. The Locomotor was used as a robotic-driven gait orthosis for the intervention group. It involved a treadmill, a harness for weight support, and two mechanical movers attached to each patient's legs. In the beginning of the study, about 50% of the patient's body weight was supported by the harness. However, this was decreased in 10% increments according to patient tolerance. In total, both groups in the study received 4 hours of gait training per week for 6 weeks, with the focus of the training on gait rehabilitation and symmetry, trunk stability, and weight support on the affected leg.
Jane, I'm so glad you asked us about this. I'm going to keep talking about the study that Joanna first introduced you to. This study set out to measure the patient's ability to walk independently after a stroke. They used several common tests to measure these results, tests that you've probably already used in your practice. They used the 10-meter walk test, the tug test, the 2-minute walk test, and the number of stairs climbed test. They used these tests as a measure of improvement of motor functions and gait abilities. Their experimenters used the FAC score, which is the Functional Ambulation Capacity score, the SAS score, the Stroke Activity Scale score, and various gait parameters. It was found that the patients in the intervention group, the ones that did PT with the robot-assisted gait training, at the end of the 6-week training period, had significantly higher FAC scores than the control group. The intervention group also had significantly better scores in the number of stairs climbed test. However, this study did have some limitations. There was high attrition in the intervention group, but they did give the reasons for dropout. Of the 37 patients in the intervention group, 8 of them dropped out. Some left because they wouldn't comply with treatment, and the others had to leave for various health reasons. The results were measured on an intent-to-treat basis, meaning that any results from patients who dropped out of the study were calculated using baseline measurements. Because there was high attrition in the intervention group, results were calculated for 37 patients when only 29 patients completed the intervention. Instead of excluding that data, it was included. There were uneven amounts of types of stroke in each group, which could affect the ability to generalize any results. And because Eunice had a hemorrhagic stroke, these results might not apply to her. So Jane, this study has some promising results for RAGT treatment of stroke patients. Now you can decide for yourself if you want to implement this into your own practice.
It sounds like Eunice might benefit from this treatment, and it also sounds like these results could be applicable to Eunice since she is trying to regain her walking ability, and this study specifically tested gait abilities in stroke patients. So this might work for her.
Are you guys talking about robot-assisted gait training? We just read the most interesting article. There's this randomized control trial that recently studied the effectiveness of using a gait exercise assist robot, or GEAR, in comparison to traditional physiotherapy and gait training in stroke patients with hemiplegia. GEAR is a wearable knee-ankle foot orthosis robot used with a treadmill, a safety suspending device, a robot body weight support device, a monitor for patient use, and a control panel. The primary outcome tested was functional independence measure, or the FIM walk improvement efficiency. Patients were included or excluded if they had the following conditions. 26 patients who were admitted to an inpatient rehab ward were included. 13 patients in the control group received physiotherapy, conventional gait training, and occupational therapy. 13 patients in the intervention group received physiotherapy, gait training with the use of robot assist gait, and occupational therapy. Both groups received treatment for a combined 3 hours per day, 7 days a week, for an intervention period of 4 weeks.
Hey Jane! I'm glad that you're looking more into this before applying it to your patient. So to expand on what Jessie was saying, let's take a look at the results of this study. This study aimed to measure the effectiveness of gait training using the GEAR system versus conventional gait training among stroke patients with severe hemiplegia. To measure this, they used the functional independence measure of walk improvement efficiency as their primary outcome measure. If you look at this time course figure, they found that the FIM walk improvement efficiency to be significantly higher in the GEAR group than the control group at 4 and 8 weeks after intervention. However, other than these two time periods, they did not see any significant differences between the two groups. Aside from this, we also need to keep in mind the limitations of this study. First, admitted patients from a single hospital who had severe hemiplegia after primary stroke were the ones recruited as participants. Hence, the results cannot be generalized to our patient. Second, both inclusion and exclusion criteria were listed. However, although the assessment measures used in the inclusion criteria were mentioned, their validity were not discussed. Third, aside from the other baseline parameters being similar between the two groups, the ratio of men were significantly higher in the GEAR group. Fourth, a therapist experienced in using the GEAR system determined the robot parameters used. Therefore, participants in the GEAR group each had different adjusted robot parameters. Okay, Jane, after hearing about the results and limitations of this study, do you think this is clinically relevant to your patient?
Sounds like this one is applicable to Eunice since her age and condition match those of the study's participants. This study's primary outcome of functional and independent walking is identical to Eunice's goal of independent walking as well. So based on this research, it seems that the Gait Exercise Assist robot and the robot-assisted gait training can be effective in improving independent walking ability in early intervention. But long-term effects after discharge is not significantly more effective than traditional physical therapy for gait training.
That's exactly what we're saying, Jane.
Thanks so much for your help, guys. I'm excited to look into this more, but it sounds like more research needs to be done to really test its efficacy, and I want to see more research before I use it in my evidence-based practice.